Hello everybody, and welcome to Species Specifics. Today we're going to be discussing our fish species. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I have also highlighted key, easily recognizable characteristics in bold. First up, for our fish, we're going to take a look at some diseases linked to environmental conditions. Chlorine and chloramine are common additives in municipal water sources. Chloramine is bound to ammonia and releases that ammonia when the water is treated for chloride. Clinical signs of this toxicosis include ragged fins, mucus on the skin and gills, and cloudy corneas. Prevention involves regular testing of water chlorine levels. New tank syndrome is when there are rising ammonia levels during the first 2 to 3 weeks after setting up a new tank. This occurs because the microbial population of the biofilter has not had adequate time to develop. This results in cloudy and smelly water. To help prevent this syndrome, you can use nitrifying bacteria or feed the filter with fish food prior to adding in the fish. Old tank syndrome results from a combination of high ammonia levels, high nitrates, and low pH, and it usually occurs due to inadequate water changes. Clinical signs are subtle and vague, such as things like having an increased risk of parasitism or disease. Treatment involves regular water changes and neutralizing the ammonia in the water. Brown blood disease results from high nitrites, a breakdown product of the nitrogen cycle. This product forms methemoglobin when absorbed into the bloodstream, resulting in brown-colored gills. Treatment involves water changes or increasing the water chloride content. Goiter in fish results from high nitrates in the water, which is a goitrogenic compound. Nitrates block the uptake of iodine by the thyroid gland, resulting in thyroid hyperplasia. The main clinical sign that you see is ventral midline swelling. Treatment involves dietary supplementation of iodine if water exchange is not possible. Finally, we have gas bubble disease. This results from supersaturation of water with dissolved gases, particularly nitrogen. Clinical signs include exophthalmos and gas emboli within the fins, gills, or other tissue. Treatment involves aeration to remove excess gas and correcting the underlying cause of the supersaturation. Next, we have several parasitic infections to take a look at. I am not even going to attempt to say this parasite name, but it is usually shortened to ick. Ick and cryptocaryon are external ciliates that affect fish. Ick affects freshwater fish, while cryptocaryon affects saltwater fish. The main clinical sign is white spots on the fins and the skin. Treatment involves formalin, copper, or salinity changes for about 1 week. Whirling disease is caused by Myxobolus cerebralis. Fish are infected when they are young, resulting in abnormal cartilage development in the spine and skull. The main clinical sign is whirling or a rapid tail-chasing behavior, but skeletal deformities can be seen as well. Prevention involves testing any new stock before introducing them into a fish population. Monogynia are flatworms that affect the internal organs of fish. Clinical signs include flashing, which is rubbing against structures, kind of like they're itching, a pale color, swollen and pale gills, and hemorrhage or ulceration of the skin. The main treatment for this condition is praziquantel. Lernea are the anchor worms. These species are common in aquarium and pond-reared fish. Clinical signs include visible parasites, skin inflammation at the attachment site, and flashing. The main treatment is diflubenzuron, which is a chitin synthesis inhibitor. Argulus are fish lice that hook onto the fish's skin for feeding. Clinical signs include flashing, erratic swimming, and anemia. Diflubenzuron is the main treatment used for this infection. Hamburger gill disease is caused by a myxosporian parasite with a really long name, so I will just refer to it as A. ictaluri. This pathogen affects catfish. The main clinical sign is hamburger gills or swollen and bloody gills. There is no validated treatment available for this pathogen. Proliferative kidney disease is caused by another myxosporian with a really long name, T. bryosalmoninae. This pathogen affects salmonids, in particular rainbow trout. Clinical signs include lethargy, darkening of the skin, pale gills, and ascites. Treatment typically requires depopulation. Finally, we have the water molds. These are actually fungus-like protists, such as saprolegnia. Infections are most common in freshwater fish. Clinical signs include cotton-like growths on the skin, gills, eyes, and fins. Treatment focuses on optimizing husbandry and performing formalin or hydrogen peroxide treatments. Next, we have several bacterial infections. Aeromonas and vibriosis are similar pathogens. Aeromonas affects freshwater species, while Vibrio affects saltwater species. Both pathogens result in hemorrhages on the fins, tail, muscles, gills, and internal organs that may progress to deep abscesses on the skin's surface. The main treatment for these pathogens is antimicrobial therapy. Columnaris disease is caused by Flavobacterium columnare. This bacterium affects warm water fish species and causes white or gray patches on the skin or gills. Treatments may include antibiotics, chemical baths, or salinity changes. Streptococcosis is primarily caused by Streptococcus ineae in fish. This is a pathogen with zoonotic potential. In fish, it causes petechiae, exophthalmos, a distended abdomen, skin pustules, and sudden death. Treatment focuses on antibiotics and optimizing husbandry. Francisellosis is caused by Francisella noatuensis in fish. This is an emerging septicemic bacterial disease of wild-caught aquaculture species. Clinical signs include anemia, petechiation, white foci on the gills and internal organs, and sudden death. Treatment focuses on improving husbandry and increasing water temperatures. Epitheliocystis is caused by a chlamydia-like bacterium and primarily affects freshwater species. It affects the gills and the skin, causing lethargy and dyspnea. The main treatment available is tetracycline. Mycobacteriosis can be caused by many different Mycobacterium species in fish. These species are all potentially zoonotic. In fish, they cause ascites, skin ulceration and hemorrhages, exophthalmos, and potentially large masses. There's no known effective treatment for this condition in fish. Enteric septicemia of catfish is caused by Edwardsiella species. These bacteria cause petechial hemorrhages, abnormal behavior, and hole-in-the-head lesions that are associated with inflammation. Treatment involves antimicrobial therapy and vaccination of fingerlings for protection. Next, we have the viral infections. Carp pox is caused by cyprinid herpes virus 1, and it affects common carp and koi. This infection results in smooth, raised lesions on the fish. Most infections are self-limiting and do not cause significant clinical signs. However, the lesions can affect the value of the fish. Herpes viral hematopoietic necrosis is caused by cyprinid herpes virus 2, and it primarily affects goldfish. Clinical signs include anorexia, pale gills, and ascites. And on postmortem, you can see pale foci in the spleen and kidneys. There is no treatment available, and fish will continue to be carriers of this virus. Koi herpes virus is caused by cyprinid herpes virus 3, which affects koi and common carp. Goldfish may also be carriers of this virus. Clinical signs include mottled red and white gills with obvious hemorrhage in some cases. Depopulation is strongly recommended due to the risk of animals developing a carrier status. Spring viremia of carp is caused by a vesiculovirus. This is a notifiable disease in most areas. Clinical signs include darkening of the skin, hemorrhage, ascites, and pale gills. Treatment involves depopulation. Lymphocystis is caused by an aretovirus and affects marine and freshwater fish. It causes cauliflower-like lesions, particularly on the fins. Most cases of this disease are self-limiting. The next few viruses primarily affect farmed fish and require depopulation to treat. We will start with channel catfish virus disease. Channel catfish virus disease is caused by a herpes virus that affects fry and fingerling catfish. Clinical signs include ascites, exophthalmos, and hemorrhage in the fins. Infectious salmon anemia is caused by an orthomyxovirus and affects farmed salmon. This is another notifiable disease. Clinical signs include lethargy, anemia, and death, with a dark liver containing foci of necrosis found on post-mortem. Viral hemorrhagic septicemia is caused by a novirhabdovirus and affects trout and salmon species. It causes widespread hemorrhage, including affecting the skin and the eyes. At necropsy, there is marked necrosis of the kidney's hematopoietic tissue. Epizootic hematopoietic necrosis is caused by a ranavirus and is also notifiable. Clinical signs include lethargy and darkening of the skin, and you can see foci of necrosis in the liver and kidney on postmortem. Finally, we have infectious pancreatic necrosis, which is caused by a burnavirus. This disease affects salmonid fry and fingerlings. Clinical signs include darkened skin, petechiation, and abnormal swimming. Lastly, we have one final condition to mention. Swim bladder syndrome refers to unwanted increased or decreased buoyancy due to a problem within the swim bladder. There are many possible risk factors, ranging from infections to feeding regime to anatomical variations. Clinical signs include sinking or floating excessively, or floating on their side or upside down. Treatment targets the underlying risk factor leading to the syndrome. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. If you're feeling generous, there is also a link in the description where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.